we will talk about hypotension or low blood pressure. It affects around 5% of world population, and we defined low blood pressure when first measurement of blood pressure or systolic blood pressure is less than 90 and second measurement or diastolic blood pressure is less than 60. But in elderly, for example, it can be lower and it still can be normal. And what person says first when he or she has hypotension? She says, I feel dizzy or lightheaded, because dizziness and lightheadedness is first and most common symptom of hypotension. It occurs around 80% of cases, and it happens because of insufficient cerebral perfusion, because of low blood pressure causes lack blood supply in brain, and it causes dizziness. Second important symptom is fainting or syncope. It's common because person who has hypotension, at least once he or she will experience syncope or fainting like condition, but it does not mean that he or she will feel syncope every time when she will have hypotension. It also occurs because of acute cerebral hypoperfusion, and blurred vision is important symptom also, which occurs around 30% of cases of hypotension. It's because of reduced blood supply to retina and eye muscles. It's important. Retina supply also decreased. And fatigue occurs around 20% of cases, and it happens because of global tissue hypoxia and poor perfusion of muscles. Now let's say what is the most common causes of hypotension. If person is relatively younger or below 40, orthostatic hypotension is the most common cause. And orthostatic hypotension means that when blood pressure sudden drop when person stands up from sitting position or from lying position, and person feels dizzy. And why it happens? It happens because of gravitational force pulls our blood down to extremities, and our blood vessels should constrict instantly to compensate these gravitational forces. And when it is delayed, orthostatic hypotension occurs. Usually it's harmless, and most simple treatment is sitting up or standing up slowly. It's important, and fluid intake also important, which increase hydration and which increase blood pressure. And salt intake also important. Consuming more salt increases blood pressure also, and compression stocking sometimes also advised. Now let's say what is the most important causes after 40 among older population. Medications is the most common cause of hypotension. When they drinking antihypertensive medications, many cases it lowers blood pressure importantly. Second most common cause is dehydration. Dehydration is important among younger people also. That's why it has high percentage. Volume depletion, reduced cardiac output is important mechanism, and dehydration causes hypotension. And treatment is fluid repletion. Also salt is important, and electrolyte supplementation. And third and very important cause of hypotension is cardiac causes, which occurs around 15% of cases. And different cardiac disease can cause hypotension, like heart failure, valvular heart disease, myocardial infarction, and sometimes arrhythmias. But arrhythmias rare. hypotension caused by arrhythmias is relatively rare, around 15% of cases, and 85% of cases is because of heart failure or valvular heart disease or myocardial infarction. And diagnostic methods at this case is EKG and echocardiography. And we should mention also exercise. During rigorous exercise, person loses electrolytes and water, and major electrolytes are sodium chloride, potassium, and small amount of calcium and magnesium. And losing these electrolytes can also cause temporary hypotension because of dehydration. So replacing these fluids and electrolytes are important. That's why even tennis players are eating bananas, which are rich source of electrolytes and glucose and energy also. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.